Hi, welcome to the Alternative Healthcare Center. The purpose of this video is to introduce you to our clinic and the healthcare services we offer. At the clinic, we pride ourselves in offering a full spectrum of alternative healthcare services in a professional and caring atmosphere. The full-time doctors on our staff combined have 50 years' experience in assisting patients to get well. Alternative medicine is growing and will continue to grow. Remember, the word alternative in alternative healthcare means that you have a choice from conventional surgery and drug treatment. We feel that medicine is wonderful for emergencies, but falls short in handling chronic conditions. These chronic conditions would be such things as asthma, arthritis, colitis, irritable bowel syndrome, headaches, ADD, allergies, chronic fatigue, congestive heart failure, back pain, neck pain, carpal tunnel syndrome, stomach trouble, poor circulation, and many more. Alternative medicine works on handling the cause of your health problem, not just merely elimination of symptoms with conventional methods that not only don't cure the problem, but create unwanted, dangerous side effects. The cause of your health problem is that your body is out of balance due to structural misalignment of the spine, nutritional deficiencies, allergies, or combinations of all three. Thus, this type of work doesn't treat conditions, but rather the body as a whole so it can get well. A simple explanation of this would be chronic migraine headaches or headaches of any type. Aspirin or Tylenol often leads to heavier type medications and sometimes to shots just for relief. Rather, the cause of the problem can be a misaligned vertebrae, a food allergy such as corn, citrus, chocolate, etc., or a malfunction of an organ such as the liver. While working with the cause may take a few months, the benefits are huge as you are not covering up the problem. A simple analogy would be if your oil light went on in your car. Would you put a piece of tape over it, which is drug treatment, and keep on driving? Or would you add or change your oil, which fixes the cause? Regarding medication, statistics show that when you take 3 drugs, you have a 50% chance of a drug interaction, and when you take 5 or more drugs, you have a 100% chance of a drug interaction. This compounds the problem of already not treating the causes of your health problems. Now I would like to introduce Dr. David Jantz, who will explain our unique muscle testing and nutritional techniques. He will also be briefly demonstrating chiropractic methods.
The purpose of this section of the video is to go over a new and revolutionary technique called nutritional response testing. And first of all, before I get into how the technique works, I want to acknowledge the founder, which is Dr. Freddie Ulan. And he basically was in bed for 23 out of 24 hours of a day, nearly dead, and was able to bring himself back to life with the help of this technique. And then what he developed later, as the years progressed, he was able to make this into a very efficient and very competent technique. So what I'll do is I'm going to go through how we test a patient. I'm not going to go into every single detail, but I want to make this so a patient can look at it and they can get a basic understanding of what's happening here. So a lot of people don't really understand what muscle testing is, but what you want to do first when you are muscle testing is you want to get a solid lock with the arm. So if you're the patient, you want to match the doctor's resistance. It's not a fight, but you're just meeting the doctor's resistance while you're testing. You can use a leg muscle, an arm muscle. You can have the patient stand and put their arm out. It does not really make much difference how you do this. We do this for convenience, and the patient does not wear out as quickly. So what you're doing here is picture it like an EKG machine where you're doing an electrocardiograph. And if you put leads on the chest, you have those leads are running off to another machine where it takes a graph and then runs that graph of how your heart, how it's beating and the various electrical current of the heart. But what makes that pencil move, so to speak, on the graph is the electrical function of the heart. So that electricity has to flow through those wires to make that graph actually come out onto the paper. So what we're doing here is it's the same concept where I'm hooked up with her arm touching a reflex point or an organ, and you've got that loop going from my contact on the body through my body to this arm, because we do have an electrical flow around our body. There's an electrical field around a door, a chair, bodies. There's electrical field around nutritional supplements and things that we test, various test kits that we use, and you're using that to actually test the body. And what happens is that on the organs, and just for convenience sake we'll use the liver, you've got nerves that innervate the liver, but there's also nerves that come off the liver and come up to the surface of the skin, and that's called a dermatome. And on those dermatomes you can actually compress and get a read with what's actually happening with the liver, because what's happening in that skin or dermatome area is also kind of a mere function of what's happening inside the liver. Or you could be doing the adrenal or the small intestine or the brain or the thyroid. So you have all these various areas that we put a light compression on to actually test them. Why do we compress? Because let's say her liver has infection or heavy metal poisoning, or there's an allergy affecting the liver. By compressing that already stressed area, you're putting that little extra stress on it, and a weak muscle will then, or excuse me, a strong muscle will then go weak. You'll have that reverse change where a strong muscle will go weak. So just that light compression puts a little more stress on the organ, and then it reads right through the muscle. Okay? So let's put that down for just a sec. So you're basically working with the electrical flow of the body. And there are numerous research has been done on this, and there's been pictures that have been taken with what's called Kirlian Photography. It's been documented since 1949 with special photography that we do have a field around our body and you can photograph it. So it's not really an argument that that field's there. It's just that we're actually using this field with a precise technology nutritionally to get into the body and find things and then correct them. Many patients come here from all over the country because they're not getting results with typical medical treatment. And the reason that we get great results is that we can get deeper into the body and find what we call hidden health stressors. And many patients, or most all patients who are having a chronic issue, have a hidden health stressor that really is the responsibility of the physician to find. And those hidden health stressors fall under 5 categories. One of them is scars. Scar tissue can actually create a stress. And what happens with that is if you have a scar, let's say she had a scar on the back of her wrist, that scar will act like what's called a capacitor. And what that means in electrical terms is it stores electrical energy. So you can have a scar that will store up electrical flow on your body, and then it lets it go at periodic times, especially when you're stressed, and can create a massive confusion in your nervous system and throw off the supplements you're taking, throw off medications you're taking, cause erratic results. And it will also act like a bad organ, for simplicity terms. Like, you can just look at scars as like they're almost like bad organs, and they have to be handled because this scar here could connect up with her left kidney, as an example, and throw that left kidney off. Sometimes the scars are right over the organ and create a stress. Other times they're at a distant opposite side of the body and creating stress way opposite from the other end. In other words, you could have an ankle scar creating a problem in the left lung, as an example too. So we handle these scars with vitamin E oils. We do a special remedy on a machine to take the stress off the scar, and that can be a crucial point in your care. If that's not handled, often your program will start to work and then fail, or will never actually get going in the beginning. So that's one of the first stressors. The second stressor can be chemical poisoning. We're all aware of chemicals in the environment, from pesticides to herbicides to chemicals to hydrocarbons from exhaust to petroleum solvents that are in shampoos and creams, etc., chlorine in pools, chlorine in water. We've also got a third stressor, heavy metals. And most of us are familiar with a few of the heavy metals, and that's mercury, because that will leach off the fillings in teeth. Aluminum in deodorants and antiperspirants gets rubbed into our armpits and gets absorbed into the pores and can create a poisonous effect on the body. And there's many other heavy metals, but suffice to say that heavy metal poisoning is very, very important in certain cases. You'll see that in autism. You'll see it in the average case that just has a chronic fatigue issue. Sometimes there's a mercury or another heavy metal that's pulling the immune system down and doesn't let a low-grade infection get out of the body. So you can actually test that particular stressor on the body and see if you need a nutritional handling on that aspect. The fourth stressor would be food allergies, and that's very common. And most often you're not aware of a food allergy. It's not like ragweed or pollen where you walk outside and your eyes get red or you sneeze or your nose is watering, etc. Food allergies can make you tired or fatigued or get colitis or have aching legs or chronic skin issues that never seem to remedy or get better. And what you do with that, you can muscle test those areas and see where those sensitivities are, and then you can work with enzymes and various things. We also do allergy clearing to help that aspect. But that can be a very, very important aspect of care, very much a hidden health stressor. In fact, some patients can eat wheat, as an example, eat a high amount of wheat that they're sensitive to on Friday night, and they'll have a headache on Tuesday from the wheat that they ate on Friday night. So it's not always date coincidence or hour coincidence where you eat it and get sick or have a quick reaction. These are usually subtle, hidden reactions that you'll get, and we can dig this out with nutritional response testing. And the fifth stressor is infection. Low-grade infection, we call it under-the-radar infection, where the immune system has been lowered and the body can never quite get rid of, whether it be a virus. The four main categories are virus, bacteria, fungus or yeast, and parasites. Many people have parasites as a sensitivity in the system, hyperactivity, chronic skin issues, fungal problems causing chronic fatigue. Often a patient had mono when they were 14 and they have chronic fatigue at 35 and they may still have mono in their system. So the key here to understand is we're not treating disease, we're treating the body. We're taking that body and we're going to balance that body and make it hum like a fine-tuned car. And as you bust and move your immune system up, then you're going to have a reaction where you're going to start to get your energy back, or you're going to get rid of a skin problem or whatever it might be. So the key is about 95% of a person's chronic problems fall under those 5 stressors that I mentioned: scars, chemicals, metals, food allergies, and infection. And of course, there's other stressors like magnets on the body, other environmental allergies that someone can have, piercings on the body like belly rings, tongue rings, sometimes the oddball things like the metal in the stems of your glasses could be throwing your body off. So there's medications can be an actual huge stressor on the body. And all these things are more the uncommon stressors, but we're trained to look for those particular things too and help find those so we can eradicate the problem on your body. So what we use is we take these various testers in the body, and these are actually wavelength or homeopathic copies of, in this situation, we're talking chemicals that I'm showing you: petroleum solvents, perfumes, fragrances, food preservatives, heavy metals, arsenic, manganese, mercury, aluminum, chromium, even zinc, lead, etc. All these things can build up in the system, and you can actually put them on the body as a group when you're testing a particular organ to see if that is the hidden stressor. And once you find that as a group, you can then break it down and find the exact stressor, whether it be mercury, lead, etc. Same with infection, the immune system being challenged: parasites, fungus, bacteria, viral. We've got food allergies. There's some of the about 20 of the most common food allergens. You've got milk, you've got even rice we have in there, eggs, organic and commercial. You've got wheat, oats, corn, millet, spelt, rye, cane sugar, etc., etc. Because these common foods that we eat every day are often a hidden stressor on your body and could be the key to unlocking your health problem. So we can test these as a group. So what you do when you move through the body and test, there's a couple of key things. First, you have to get a strong muscle. Okay, so if you want that muscle to lock, and if it doesn't, you have to correct that by checking the 5 stressors. And we do some other things that I don't want to go into great detail, but we check over orifices of the body, meaning belly button, ears, sometimes the mouth, and we'll check those various areas for what's called block regulation. And these are things where it's like a computer that has to download and has to balance to these stressors, and if it's not showing that balance, that will actually block, so to speak, the whole route of your care as far as getting well. So that was a very key thing, this block regulation, and also switching, where we put the thumb and pinky together, which takes thousands of nerve circuits to do. And it may look like a simple thing, but that takes thousands of nerve circuits. And just simply doing that, often a strong muscle will go weak, and then we have to find out why there's that confusion in your nervous system. So there's these things: blocked regulation, switching. They basically create confusion in the nervous system. You have to get that out of the way first, and that was one of the huge breakthroughs with nutritional response testing, is finding this switching and blocking, because if you don't find that on a patient first, the case will usually go awry and not get well. So you'll see the doctors and allergy technicians always checking that first to make sure the patient isn't showing that confusion in their nervous system. Once that gets handled, you basically run through the body, as I mentioned earlier, with leg compression. And you can check the brain, you can check what's called a salt reflex or electrolyte reflex. When there's heat and people are sweating, a lot of times they'll lose their electrolytes, and you have to handle that. You can check the back of the brain. You can check the pituitary gland, it's called. You can check sinus, eyes, lower sinus. You can check teeth. You can go and you can check the thyroid, and you can check the lungs. You can check the lower heart, the upper heart, spleen, stomach, liver, gallbladder, small intestine, ovaries. You can use the female patient's hand, check the vaginal tract. And you can also obviously check the testicles and the prostate on a male, and check the kidneys, adrenal glands, kidney, adrenal gland. You can check all these various areas. So what you're doing, when you find these areas, you're going to then check those hidden health stressors. Let's just say she comes in and she's got, "Doc, I've got chronic fatigue, my skin's dry, my hair's falling out, I can't lose weight." Let's just throw that as an example. And you may well know already those are thyroid symptoms. Let's say you find the thyroid and that is weak there. You would then check these various 5 stressors first, check that for nutrition, whatever matches up to that stressor, and then you would check for nutrition for the thyroid. In this test kit, which we have hundreds of supplements, but we have these very well organized and categorized for specific issues, you would reach for the thyroid nutrition and then check the appropriate thyroid nutrition and build the patient a program that will help to start getting that thyroid running again efficiently, and so then these symptoms can go away. And once again, you're not treating disease, you're not treating really the organ as much as you're balancing the body back out so that it comes back into rhythm and then it can get well. The opposite of this would be you would just use drugs, or there would be possibly surgery involved, or the patient would do nothing. But with this approach, you're using very specific nutrition. It's very targeted for a specific area, and it takes a lot of experience and know-how with all the supplements of what exactly to give, what dose, when, where, what, so to speak. So you have to run these various things through and use your knowledge with the products to get the exact product that you want to get with the person. But patients will come in, and you can, chronic issues that you see often are chronic fatigue, hormonal imbalance with females, skin issues, ADD type problems. You'll see a lot of people have back pain that's connected to kidneys. And this is coming even from a chiropractor. I'm just telling a lot of patients their kidneys are congested, and that's why their lower back keeps going out. Or their middle back will constantly ache in between their shoulders because there's a congested gallbladder. A lot of patients, even kids and even babies, will get a lot of stomach pain and nausea and burping and whatnot from a troublesome gallbladder or from a stomach not working properly. And you can have a patient that you're testing might have a weak ovary connected with a skin problem or a irregular cycle, or you'll see intestinal issues from taking too many antibiotics or steroids or too many high carbohydrate foods where you have to handle the intestine, which is causing the headaches. See, the key here is that the body doesn't always just lay out for you and go, here's my symptoms, here's the problem, 1, 2, 3, because every single day we have to connect the actual problem that the patient's having symptomatically to the actual root cause. And what I mean by that, to give you an example, a person can have swollen legs, as a simple example, and you'll find out that it's a sluggish heart, or the kidneys are functioning at a low rate and they're congested and they're causing the backup. Or the person just comes in and says, Doc, I don't feel good, I'm really tired, I don't feel like I used to 10 years ago. And that could be 22 different things, and this technique allows you to streamline it down to what the key issues are. Because most people that I meet on the street and in the clinic have an intuitive understanding that nutrition works. Most people just know that intuitively because it makes sense that you're going to use nutrition to heal the body rather than pharmaceuticals. So we keep all these things in mind when we're working on your system, and what the technique does allows us to walk into the body, so to speak, find the issue, and then prioritize it with the stressors, prioritize it with nutrition, and give you a very streamlined approach so that your body can start getting well. And a body will usually show a very, very positive result within 12 weeks or less. This is not aspirin therapy where you take an aspirin and your headache's gone in 10 minutes and covers up the symptom. This is, why do you have a headache? Why are you getting headaches 3 times a week for 30 years or whatever it might be? Let's get to the root cause of this so that we can handle it. And that's the difference. And it's not a harmful technique because you're using nutrition. We use whole foods, whole food concentrates. We use herbs, and we use homeopathic remedies, and we target them exactly for what we want the body to do. The purpose of this section of the video is to cover chiropractic care. Most people are familiar with chiropractic care, but I want to go through a few aspects of the care so that patients better understand it. When you're working with the spine, we're dealing with what's called subluxation, and that's a fancy word for what's called a misalignment in the spine, where the bones will actually twist out of alignment. And when that happens, you'll create pressure on the nerves that are exiting out at that particular level of your spine, whether it be your neck, your middle back, or your low back. And that can create problems going down the arm, like numbness, carpal tunnel syndrome, weakness in your grip, sciatic pain, which is the largest nerve in the body, and it runs from your pelvis down the back of your leg to your foot. And of course, low back pain, mid back pain. But also, the spine affects various organs, because if you've got pressure, say, at the 7th bone in the neck, and that's pinched off, that can affect the heart. So often we have to incorporate the structural approach or chiropractic approach to get the body to balance so that your nutritional work, or it can be a vice versa approach where you're having trouble with your spine, you're getting manipulations, they aren't staying in place. We'll use a nutritional approach to get the spine to stay in place. So they can work together as a marriage to help get the health of the body to a whole new level. Because often you'll have pressure, let's say in the low back, and those nerves are leading to the bladder, and you've got a chronic bladder issue, yes, you may need a nutritional approach to handle that bladder issue, but also you may have to handle the pelvic bones in the low back so that the pain goes away and it can help the bladder function more normally, because this is like a switchboard here. You've got nerves running off that spine to all tissues of your body, headaches, low back pain, numbness, connections with asthma, nausea, stomach trouble, bowels, colon, etc. All these areas can be affected by the spine being out of place. So what we're doing is we're taking that, the bones are misaligned, but they're also stiff. They're fixated, they're tight, they don't have the motion that they should. So they're very specific manipulations that are putting motion back into that vertebra in whatever range of motion that's restricted. So you're actually creating normal function and motion, which takes the stress off the muscles, the nerves, the blood vessels, etc., so that can make the body flow better from not only from that area but from a distance, and it affects the legs, arms, organs, etc. So that's what we're handling with that particular aspect. Sometimes that has to be married with a nutritional approach, but it's a very, very key issue on many, many people.
AACT stands for Accelerated Allergy Clearing Technique. This technique was developed by Dr. Fred Yulin and Dr. Lester Bryman as a refinement of Dr. Nimbudrapad's allergy elimination technique called NATE. Often patients present themselves with allergies or sensitivities to foods, pollens, mold, animals, etc., which is hindering their ability to heal and get well no matter what their health issue is. Accelerated Allergy Clearing Technique, or ACT for short, permanently or partially desensitizes the adverse reactions a patient is having to various substances. Doing so settles the body down enough to heal and make progress with your nutritional program. Often allergies create such agitation and upset of the body's systems that it will totally block any forward progress of healing. Just a few examples of sensitivities or allergies are wheat, milk, sugar, soy, eggs, ragweed, pollen, mold, mercury, vaccines, animals, fragrances, perfumes, food preservatives, food additives, etc. Allergies can be very obvious, like ragweed and mold, or hidden, such as a sensitivity to wheat or dairy. Hidden or obvious allergies or sensitivities can be all or part of any health problem, such as chronic fatigue syndrome, arthritis, autism, ADD and ADHD, hypoglycemia or low blood sugar, headaches, bladder issues, irritable bowel syndrome, asthma, chronic sinusitis, fibromyalgia, hormonal imbalances, truly any health condition. Unfortunately, traditional allergy testing misses many, many sensitivities that a patient has. With AACT, we can pick up the obvious and the hidden sensitivities. AACT involves muscle testing to discover what is adversely affecting the electrical field of the body. This is done by testing the actual substance or vials of homeopathic or electrical wavelength copies against certain acupuncture points on the body. What essentially happens is that the electrical properties of the allergen clash with the electrical field of the body and cause a weak muscle response. Interestingly enough, allergens or sensitivities to various substances can just affect one organ rather than the whole body. An example would be chlorine affecting the thyroid or a food allergy affecting the intestines. For our patients' benefit, we have accumulated hundreds and hundreds of these vials to test with. Once the offending substances are identified, this is placed against their body and very specific acupuncture points are stimulated while various breathing techniques are done. What this does is turn off the body's attacking or negative response to these substances so that the body does not further react to it, or at least minimizes this reaction. The key is the stimulation of the acupuncture points while the body is in contact with the allergen. AACT, like traditional allergy desensitization, takes a series of treatments to get optimum results. However, AACT does not involve shots and is not painful at all. In fact, most people feel slightly sleepy or relaxed after a treatment. There are books and success stories available in the clinic for you to view so as to better understand the impact of this revolutionary technique. Avatar testing is now available in our clinic to enhance your overall health. This test measures the electrical energy flowing through your body. This electrical energy flows on highways within your body called meridians. Meridians have been scientifically demonstrated to relate to your organs and organ systems. Readings are found by scanning the specific information points of your hands or feet. The information points indicate if each organ or organ system is balanced, stressed, weakened, or compromised. It can also measure the effects of herbal remedies on your organ systems. The information obtained from the analysis allows us to better balance you nutritionally and reduce the interference from scars on the body. We have found this time-tested European technique to be very beneficial to our patients' road to better health.